Colorado announced the final winner of its vaccine lottery program today. The program started last month as a way to convince more people to get the vaccine. But did it work? Denver 7's Sloan Dickey looks at the effectiveness of that program and what the next step is.
Now, the moment you've all been waiting for. We're going to introduce our $1 million winner.
Sorry, Colorado, if you're watching this and didn't get the call, you didn't win the vaccine lottery. The last $1 million went to Colorado mom Heidi Russell.
4 kids are expensive, so that's a good head start for them.
But did the lottery have an impact on vaccines in Colorado? So far, at least 70% of eligible Coloradans received at least one dose. But overall, just over 52% of the entire state's population is vaccinated. Enthusiasm started to flatten out in April, well before the first vaccine lottery winner was announced in early June. Ohio was also a state that tried out the lottery system. A study by the Journal of American Medical Associates concluded there was no evidence that a lottery-based incentive in Ohio was associated with increased rates of adult COVID-19 vaccinations.
Unfortunately, it's really difficult to gauge the success of the lottery just by looking at the numbers.
But some experts say the numbers don't tell the whole
The
story.
key question is what would have happened in the absence of introducing this vaccine lottery.
As Colorado increases vaccinations, the smaller and smaller pool of unvaccinated residents are increasingly hostile to getting a shot. Glenn Mays at the University of Colorado School of Public Health says a lottery is one of many options to incentivize vaccines, but Colorado still has a long ways to go.
I don't think we're yet at a vaccination coverage level that gives us the kind of protection we need.
Now, as the vaccine lottery ends, he says Colorado still is well below the threshold needed to reach herd immunity.
Likely we're going to need to be up in the 80% or higher level, especially given the new variants that are out there.
New techniques across the state and country are being deployed, including door-to-door outreach discussed on Tuesday by President Biden.
Now we need to go to community by community, neighborhood by neighborhood, and oftentimes door to door, literally knocking on doors to get help to the remaining people protected from the virus.
And now that the state's multi-million-dollar push to get Coloradans vaccinated has concluded, organizations are taking it upon themselves. UC Health announced last week that it will be offering a $500 incentive for every employee who is vaccinated through mid-August. It also said that it's possible that vaccines for COVID-19 will be required come later this year.